Welcome to Medical Minutes here on Time Warner Cable DMG TV2. This episode, we talk with the new director of the American Red Cross as the Stark County and the Muskingum Lakes chapters are merging. We'll also tell you how to help your sinuses with balloon sinuplasty, and Dr. Kurt Guerin will be here in the studio. As you can tell, I am at the Strasburg Fire Department, and we will also take you on a tour of an ambulance and talk with an EMT, all coming up on this episode of Medical Minutes.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
A nursing home or your own home? It's good to be home, so call Ember Complete Care for all your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home, for skilled nursing, physical therapy, wound care, and more. Locally owned and operated, Ember Complete Care has been servicing all of Tuscarawas and Coshocton County since 1986, with a yearly average of $75,000 donated back into the community. Call 1-800-462-0909. Ember Complete Care. It's good to be home.
Welcome to Medical Minutes here on Time Warner Cable DMG TV2. I'm Jennifer Clark, and today in the studio with us is Kim Crow. She is the Executive Director of the American Red Cross, Stark County, as well as Muskingum Lakes chapter. The two chapters have merged, and we'll get to that in a little bit. But Kim, tell us a little bit about the American Red Cross. When I think of the Red Cross, I think of disasters or blood drives, but it's so much more than that, right?
It is a lot more than that. We have 5 main areas of American Red Cross, and that includes blood services, disaster services, health and safety and preparedness, military. Did I do all 5? Oh, and international. And so those are the 5 main core services that American Red Cross offers to the communities throughout the country. And then in addition to those 5 core services, we also have community services. And each chapter and region throughout the country is unique in these community services that they offer. And the 2 that we have in the Stark Muskingum Lakes area is transportation. And what we do is we'll transport clients to and from doctor's appointments or dialysis appointments. And then we also have rape crisis, and that is offering services for those who have been sexually victimized.
So many things. How do you make sure that each one is done to the fullest extent?
Well, I'll tell you what, it's our volunteers. We have hundreds of volunteers out of the 2 chapters that give timelessness of over and over to support these various programs, and countless hours that they give to us. So they're invaluable. And I'll tell you, without our volunteers, there's no way we would be able to offer the services that we do 24/7, 365.
Now, the health and safety, what's involved with that?
Now, health and safety used to be out of the chapters, and now they are not part of the chapters anymore, like blood services. They're separate from the chapters, where military and disaster and then the community services are still part of the chapters. But health and safety is preparedness, health and safety services, and that's the CPR, first aid, water safety, babysitting classes, those types of services. And then they also house all the apps that we have.
There's an app for that.
Yep, there's an app for that. Our newest one is our pet app.
Wow.
So they're really awesome apps.
Now, some of the other, more specific services, if someone has a fire in their home, and what do you do for them?
Well, we have a DAT team, which is Disaster Action Team, and these individuals will respond to the fire. They will provide quilt, comfort kit, food and hotel vouchers if needed. They will, case manager will follow up to make sure that they are receiving all the services needed. The DAT team will also assist the first responders in terms of water, food, snacks if necessary, depending upon the type of disaster and or fire that it entails and whether those services need to be extended to the first responders as well.
And how are you funded?
Because
it takes money.
It does. That's certain. We rely on individual donors. We rely on corporate donors. We rely on foundations. United Way is a huge supporter of American Red Cross, both in Stark County as well as Muskingum Lakes. And grants. We'll go after, some federal grants, state grants, community grants. So we also tap into those as well.
And having so many different services in different chapters, why did the Muskingum Lakes chapter, which is Tuscarawas, Harrison, and Carroll County,
yes,
merge in with Stark County? Why are the 4 counties now together?
The American Red Cross and our head, Gail McGovern, has done has made a lot of changes throughout the country. And the main reason is that we had over 3,000 chapters 10 years ago, and we have greatly reduced that number because all these chapters were providing their own services kind of on their own island, and it just wasn't a very efficient way of running an organization. And so what we've done is, if it's not a direct service to our clients, we've centralized it. So human resources has been centralized, and our health care plans have been centralized, and accounting's been centralized, and
It
so
sounds more administrative stuff. So
that's all it is.
That the public doesn't see.
That's right, and also combining some chapters, because right now the disaster services and military already provides services for Stark and Muskingum Lakes. They always have. And so by us combining chapters, we're just becoming more efficient as well.
And so services won't change at all.
Not at all. And if anything, our services are becoming more uniform throughout the country. Where before, when all these chapters were on their own island, they kind of decided what kind of services they wanted to offer to the community. And now all the services that we offer are going to be uniform, whether it's in Muskingum Lakes, Stark County, or in California or Rhode Island. They're the same.
And different events that were unique to specific chapters, like the Muskingum Lakes chapter, they did a series called the Hometown Heroes, where they would recognize individuals and what they've done throughout the year to save a life or just contributed to the community. Will the Hometown Heroes still be going on?
Absolutely. The official date is May 14th. It's a Wednesday evening, and it's at the Senior Center. And yes, the Hometown Heroes is where we're preparing, and just had a meeting today discussing some details and some things that we need to get moving on, because it's going to be here before we know it.
And anything that you're going to do differently as you go into the future?
Well, we're combining our boards, and so that's going to be really exciting, because Muskingum Lakes the board members have a lot of gifts they can provide for Stark County and vice versa. So we're really looking forward to that. I'm really looking forward to meeting the people in this community and getting to know the area better, and that includes Tusk and Carroll and Harrison. I'm really looking forward to that component of it. I like the country. I always have liked it out. And not that Canton's real, city, but parts of Canton, or parts of Stark County, are a little bit more urban than other parts. So I'm really looking forward to that. And I think that there'll be a lot more activity down at our Red Cross building here in Muskingum Lakes too. Now that we're coming together, there'll be more staff coming back and forth, and of course I'll be down here quite a bit as well.
The phone numbers don't change, services don't change, but you'll be more efficient behind the scenes.
That's right, and we can now say that out of every dollar that you donate, 91 cents will go to direct services. And we're very proud to say that. And part of that is because of us being better stewards of the donors' dollars by doing some regionalizing and by combining some chapters and merging them together so that we're just more efficient.
Great, great. Lots of good information. If you need any more information, you can always give your local American Red Cross office a call and find out what's going on and how you can volunteer or donate or contribute in any way to help the American Red Cross. The Executive Director, Kim Crow, our guest here on Medical Minutes, and for DMG TV2, I'm Jennifer Clark. At Trinity Hospital Twin City, we have a full-time non-invasive cardiologist and experienced cardiopulmonary technologists who can help you obtain your diagnostic tests and results quickly. We also have many heart care services to help you achieve optimum heart health. Let your primary care provider know you'd like to choose Trinity Hospital Twin City for your heart care. Call 740-922-7480 to schedule an appointment with our cardiologist or visit trinitytwincity.org for more information.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, New Comerstown, and Millersburg. Let's get started building our relationship.
Welcome back to Medical Minutes here on Time Warner Cable DMG TV2. This segment around, we have Dr. Kurt Guerin. He is with us to talk about sinusitis. Now, you are an ear, nose, and throat specialist. What is sinusitis? It sounds like it's a sinus infection.
Yeah, well, I mean, quite frankly, that's all that it is. Sinusitis is just basically inflammation of your sinuses. And you know what most of us experience are the acute sinus infections. You see your doctor, they put you on some antibiotics, and you feel better.
Do you have to have antibiotics? Can you just blow your nose for 10 days and be over it?
Well, you know, a lot of times that's what most people do because the majority of sinus infections are actually viral in nature, even related to allergies, and don't require antibiotics. It's usually after about 7 days that we realize that it's probably becoming more bacterial, and we actually lean towards treating it with antibiotics.
And when do you decide that it's really severe enough for another kind of treatment?
Well, in general, after people start to have maybe 3, 4, 5, 6 in a year even, which is not uncommon around our Tuscarawas county and our valley here, or if people start to have kind of ongoing symptoms, the facial pain pressure, the chronic nasal discharge, the headaches, if they start having that for ongoing more than about 3 months, then we determine it's more likely to be chronic and we have to get a little bit more aggressive.
So the medications, do they become just more potent? Or when do you decide you need to do something else?
Well, and when we get to that point, we're usually dealing with a little bit different types of bacteria. We have to use more aggressive, more potent antibiotics. We have to use them for longer terms, longer courses. So instead of the usual 7, 10 days, you might even see your doctor giving you 3, 4, even up to 6 weeks of antibiotics. We get to that point, we also add in intranasal steroids, intranasal antihistamines, different medications you spray in your nose to try and decrease the swelling and inflammation of your nose to help the sinuses drain. If it gets bad enough, we'll even start to see people using oral steroids to try and get rid of the swelling inside the nose.
That's all it is like an inflammation of your sinus cavity.
Correct. And when it gets to that point, it's usually caused by bacteria that cause the swelling. And the sinuses have specific areas in which they drain through, holes in which they drain through, and that's what they're supposed to do. And when they get inflamed, they swell shut. And as they swell shut, that fluid that isn't able to drain that your body produces throughout the day gets infected.
Oh, that sounds awful. And can you do surgery for it?
Yeah, if people have had ongoing problems, if they've tried the intranasal steroids, the oral steroids, most of these people at this point will probably have an allergy test to see if there's an allergy component to it. And if they've been treated with appropriate antibiotics, appropriate medication, they continue to have problems at that point, oftentimes we'll do a CT scan. Actually, probably all the time we'll do a CT scan. And if we see some evidence of chronic thickening of the sinuses on the CAT scan, then at that point we'll discuss with them, possibility of surgical intervention to try and treat and control their disease.
And what do you do during surgery? Do you remove part of the sinuses, the lining, so that it opens up a little more?
In the olden days, what we used to do is we would go in, and this is many years ago, predating even my foray into medicine. They would actually go in and just kind of pop in the sinus and rinse them out and hope. And then we got a little bit better, and we were able to use endoscopes, so we can go in and actually directly look at it. And then we did start to remove tissue. We would take down part of the tissue, trying to open up the sinuses. In this day and age, over the last about 5 to 6 years, we've significantly improved our techniques. We're now using what we call balloon dilatation. It's based on the old cardiac catheterization. We take a balloon, we put them into the affected sinus, we get it into the actual natural opening of the sinus, and we dilate it up. By doing so, we actually remove the tissue and open up the sinus. Because it's mostly bone, it outfractures, and when it does that, it heals open to create a larger passageway so that chronic inflammation will no longer exist, because the fluid will be able to drain out of it.
That sounds painful. So you kind of break their nose open and it stays open.
Well, surprisingly, with these newer techniques, there's minimal pain involved. In fact, most people undergoing that type of surgery are getting back to work within a couple of days afterwards, and even to the point now where we're doing these in the office under a local anesthetic with the patient awake and not sedated, and they're going home the same day and returning to work even the next day.
And how long does it last?
Well, indefinite. I mean, at this point, because you're not really removing any tissue, you're just opening it up to be natural, you're returning it the way it was supposed to be. If it heals the way we want it to and the way it's supposed to, it should last pretty much forever.
Now, what about those over-the-counter nasal strips that you put on the outside of your nose and opens, are those any good? Or?
In some people they work fantastic. If the obstruction, the issues are on the outside, and it's actually where your cartilage are collapsing on the outside, they will work for a lot of those people. In general, most of the people that we're talking about, the issues are internally inside the nose, and they need a little bit more aggressive approach.
And then, what if you can't decide what to do, and you try meds? How long do you go? Like, you were talking 12 weeks or 52 weeks?
A lot of it depends on the response that the patients have from the medication. If they're getting a little bit of response, we'll give it a little bit longer. If they're not, and they have good evidence of chronic sinusitis symptoms, have been treated appropriately in the past, and have the CT scan evidence that there is some disease process, then we're more likely to get aggressive. Particularly now in this day and age when it's a lot less invasive procedure. These people are going back to work. Unfortunately, in the past, the way we used to do it, these people would undergo surgeries and they would wake up and they'd have packing in their nose. They were miserably uncomfortable. It was unbearable. The packing stayed in for about a week or so. Then it had to come out in the office. It was uncomfortable. It really deterred a lot of people from having a necessary procedure that would really improve their quality of life. With the
so they can actually breathe.
Correct. With the newer technology, with the balloons, we can go in, open up sinuses, get things to drain out, make them feel better. They're feeling better, and within 2-3 days, they're pretty much back to normal. Rarely do they even require analgesics, oral pain medicines.
Wow. Now, do you just go to your primary care physician and they can do it, or do they need to refer you to a specialist like you?
In general, these are only performed by specialists. In fact, the newer technology while it's readily available, has not been adopted by all surgeons. There's only a handful of us in the entire Northeast Ohio regions actually doing these. And as far as locally, as of right now, I'm the only one that's been trained to do them in the office.
And a lot of people only want the procedure if insurance will cover it. Is this a old enough procedure that insurance companies like it yet?
It certainly is. I mean, it's already been approved by the FDA. It's been done for actually about 7 years commercially available. I've been doing about 6.5 years myself. With all the time that they did with the research and things developing this, it's been around for about 10, 12 years. All this really is a different way to open up sinuses than what we used to do. So as far as the insurance companies are concerned, it's no different than any other intraoperative surgical procedure. And in fact, it's so widely accepted that they created special codes to make sure we got paid for doing them in the office. So there's no issues with insurance companies.
And are there any particular patients that, you know as soon as they walk in the door that, oh, you're a balloon patient, let's take care of that, or do you try everyone on medication first?
In general, everybody gets tried on medications first. I mean, when we get into surgical, intervention, while I am a surgeon, we do enjoy that. I mean, you really have to make that the last resort, particularly when a good number of patients will resolve and their symptoms will improve with, the conservative medical management, allergy therapy if they have allergies. So, this is usually reserved for people who are kind of the last case scenario. They've tried everything else. They're still having symptoms. They, they present to the office. They have the typical facial pain, pressure, chronic nasal drainage, headaches, little visual changes, even teeth pain, and the nasal obstruction. They're just kind of miserable, and they're like, hey, enough's enough. and they show up, and we work them up, do the CAT scans, and we look at them and say, hey, you know what? It's time. It's time to get some relief for you.
Yeah, it's a lot of patience of, being patient where, okay, how much can I possibly take?
Right, and a lot of that is dictated because of the definitions we have, and for it to be chronic, it has to be at least 12 weeks. So unfortunately, patients suffer for a little bit being treated with antibiotics before they usually get to proceed forward with surgery if they need it.
All right, very good information from Dr. Kurt Guerin from Dover. Thanks for being on Medical Minutes.
Well, thank you.
Are you suffering from asthma or emphysema? Do you have shortness of breath or a nagging cough you just can't shake? Hi, this is Dr. Nathan Samsa. I'm originally from Strasburg and I've returned after my medical training to serve the Tuscarawas Valley. I'm board certified in pulmonary medicine and I'm ready to treat your breathing and lung problems. My office is located at Union Internal Medicine Specialties, 515 Union Avenue, Suite 187 in Dover, Ohio. Call me at 330-343-4411 for a timely consultation.
Hi, I'm 1450 WJER's Bill Morgan, inviting you to join me on television Wednesday evenings at 7 and Friday afternoons at 5 for TV2 Sports Talk. Sports Talk is your weekly look inside high school football, volleyball, soccer, and more. Look for guest appearances from your favorite area coaches and players. TV2 Sports Talk, Wednesday evenings at 7 and Friday afternoons at 5 on DMG Channel 2 on Time Warner Cable.
Welcome back to Time Warner Cable DMG TV2's Medical Minutes. We are on location at the Strasburg Fire Department, and with us is Lieutenant Andy Slemmer. And Andy, tell us where we are. What is this?
This is our first out ambulance, and we usually take this out on everything versus anything from medical alarms to accidents, you name it. This is what we usually take out. We usually got a bunch of different equipment here. Right here is our Life Pack 12. What this does is we can take basic vital signs, BP, we can hook you on the 12 lead, and we can transmit that to the hospital. If you are having a heart attack or anything like that, we can transmit, and that gives them a heads up what they're expecting. This also shocks. It's a defibrillator too, so if you are in cardiac arrest, we can actually shock you.
And do you use that a lot?
Not so often. We usually use the monitor and that to transmit that, but usually don't shock too many people, which is a good thing. Usually, that's good.
And when you have a patient, it's just second nature to you to hook them up and test them. For me, that would be really exciting to make sure that you're going to save somebody's life.
Right. I mean, we do this day in and day out, so we kind of know what to do in that. And this is what we call the first in bag, and just some of the stuff that we got in it. This is a bag valve mask. If they're not breathing, we unhook this and the mask goes over their face and we actually breathe for them. We just got a manual BP cuff. We got pulse ox, and we got basic bandages and stuff in here. And also trauma dressings. We actually got first in drugs that the medics give. We actually got 2 medics on the department, so like I said, there's first in drugs for them if they're having cardiac arrest.
This looks like a really extensive first aid kit.
Yeah, it's pretty is. You got to know where stuff is. Like I said, we got stuff all over the place. Another thing is, this is what I'm holding, is O2 bottle. And like I said, if people need O2, we can hook them up on that.
And O2 is just oxygen.
It's just normal oxygen, yes, till we get them out in the squad, and then we can hook them on the O2. That's what that thing's beeping right now in the squad. I don't know if you guys can hear it or not, but it's beeping to let us know that the O2's on.
Just to make sure that when you hook them up that they're not getting nothing.
Right, exactly.
And in front of you is this gurney, and it's attached. It's not going anywhere.
No, like I said, once we get it in here, it's actually secured in that pretty good, and it won't come undone until we release the lever down there once we get you down there at the hospital. So you're actually safe and sound. We put some seat belts on you, that way you don't get up and run away from us. So once you're in the back, you're ours.
And there's so many cabinets. What's in all of this stuff?
A little bit of everything. There's usually right back in here, we got the vacuum splint. If somebody was to break their legs or arms or anything, we can put the vacuum splint on it. What that basically is, it's just like a giant cast. We put it around the body and we suck out all the air, so it just turns out to be a hard cast. Up in here, we got a burn kit, and we got extra supplies in that, extra pads, and we got extra bandages up in here. Up behind me, we got hot and cold packs, because you never know what you're going to get into. If it's in the middle of the summer and they're hot or whatever, we can use ice packs and that to cool them down, or vice versa. If it's in the wintertime, we can use some hot packs to warm them back up. Right behind me here is the onboard suction. If they got a bunch of fluid or a bunch of phlegm and that stuff, we can suck that out. Right here is how we hook up the O2 on the main board. We just turn that on to the number that we want, and then they can get O2. Up here is just a bunch of different controls that we control back here. Just for example, there's lights up here, and the oxygen, and then that's how we turn on our suction. Right here is also a mini fridge. That's where we keep some of the drugs at to keep them in there longer. They actually stay fresh longer. Right behind you in that compartment, that blue bag, if you can see it, that's actually our pediatric bag, which we don't run too many peds calls.
That's children.
Yes, children. That red bag right next to it is a portable suction. And the yellow bag, I don't know if you can see it back there or not, but that's actually what we call a CPAP machine. If they're having difficulty breathing, we hook that up to them. And basically what that does is each time you breathe, it actually forces air down in your lungs and it forces that fluid out, so it makes you actually breathe a lot easier. So there is a bunch of gadgets and a whole bunch of other stuff in here. Like I said, you got to keep on your toes. But basically, this is our front control panel. This button here that I'm pushing, it controls all the flashing lights on the vehicles. These other buttons is left flood and rear flood and the right flood. Basically all it is a giant spotlight. If we go out there in the sticks, we can't find a house, whatever, like I said, we'll hit that button and we'll light up the side of the road. This screen right here actually tells us that if there's any doors open, or it tells us the temperature, and also it's a backup camera. If we throw this thing in reverse, it actually has a camera on the back of it, so we can actually see using the mirrors and actually using the camera back in the back. So it actually comes in handy pretty often. Below that, we got our sirens right here. And below that, we actually got our radio. That's what we actually use to call 911, and we relay the message back and forth.
Now, how do you learn how to use all this stuff and when to use it?
You got to go through schooling. There's 3 different classes. You got EMT Basic, which I am. You got EMT Intermediate, and you got EMT Paramedic. We got to keep updated every 3 years, depending on what level you are. Like I'm at EMT Basic, so I got to have 42 hours every 3 years to keep my certification up.
And does it change ever? I mean, healthcare is healthcare.
No, it does change. We run through Union Hospital, and we got to go by their rules and that, and they ended up changing all the protocols. And we just updated that. Now it's actually, it used to be on paper, but now it's actually on an app. So you can download it to a phone and you can type in what you got, and it will actually bring it up and it will tell you what to do.
And what are most calls? Are they mostly heart attacks?
It's hard to say. Most of them is, we run on a bunch of geriatric patients with a bunch of the older people. And it's anywhere from the flu or like general weakness. They're not just feeling well and they just want to go down and get checked out just to make sure everything's okay with them.
And are there a lot of calls for an ambulance that are unnecessary?
Yes. Unfortunately, we get called for toothaches and earaches and bloody noses and that. And like I said, I mean, it might be emergency to you, but not so much towards us.
When do you call an ambulance? Did you call 911 first?
If you're unsure, yeah, definitely call 911. And like I said, we'll come out and we'll check out the situation. And then if you need to go, we'll be more than happy to take you down there and we'll get you checked out. We'll get you back on your feet.
And people are probably pretty appreciative that you come out.
Oh, yeah, most definitely. They thank us all the time for taking care of them, and they tell us all the time what a good job we're doing.
Now, how many ambulances do you have in Strasburg?
We currently got 2.
So if one's running, you have another for a backup.
Right, we got another one for backup.
How often do both of them go out together?
The other day we had 6 calls altogether. We was on scene of an accident, and then we got paged out for chest pains, and then we got paged out for a cardiac arrest, and then I forget the other call, and then later on in the night we had 2 more calls back to back. So like I said, it just depends. Since we're volunteer, it's either hit or miss. Sometimes we can get slammed all at once, or might go days without having anything.
And then you have to restock.
Right, that's the main thing. Like I said, once we go down there at the hospital, we just got to make sure we restocked for the next patient.
And like the other day, it could happen back to back to back.
Right, and that's why we usually like carrying extra supplies and that, just depending on what we use. Like I said, we usually got a couple of everything on here, so in case we do got to run code 3 back from the hospital, we actually do got stuff on here that we can go on scene and treat that other patient.
Wow, what a great, exciting career. And all of the stuff, knowing all of that, I feel safer already.
Well, thank you.
Lieutenant Andy Slemmer, he is with the Strasburg Fire Department, giving us a quick tour of an ambulance here for Medical Minutes.